Before my very first day of chemo, I was feeling very anxious, not knowing what to expect, what the side effects might be, all those things are playing on my mind.
When you first get diagnosed with cancer, you don't know what's going to happen, and that can be really overwhelming. The thing for you to remember is that we're here as a team to support you, and we're going to be with you the whole way. On your first day, it's really important to just behave just exactly how you would every morning. Have breakfast. If you're right to have all the medications that you normally have that. Make sure that you're quite hydrated, so drink lots and stay warm.
You need to have things to keep you busy, books to read or iPad and earbuds to listen to your music or a podcast. They do give you lunch and food, but it's good to have your own snacks.
Bring your charger if you're bringing an iPad or an iPhone, and we do have Wi-Fi for you.
I brought the same things every week. I brought some little crystals that I held in my hand. I bought some cards. I definitely brought a support team every week.
I think it's always really good if you've got somebody who can come with you to your treatment, mainly because they're that second pair of ears for you. And plus they give you a bit of company while you're sitting there having your treatment. When you first arrive, you'll be greeted by a very friendly admin team.
So you sign in at the front counter, you fill out paperwork always.
When you first arrive, one of the nurses will come and get you from the waiting room. On the way down to your treatment chair, we'll take your height and your weight because we need to make sure that you're receiving the correct dose of chemotherapy. And then we'll take you to your treatment chair and explain what's going to happen for the day.
The first thing they do is take your vital signs, your blood pressure, temperature, and then they start to prepare you to take the blood, because the first part of my treatment anyway was always a blood test. They send that off, they have that ready within an hour, and then they know whether they're right to proceed with the day's treatment.
I guess the first thing that was a bit of a surprise was just how friendly the nursing staff were and how caring they actually are for us.
They're not in a hurry or a rush, so they can actually take the time to make you feel really comfortable and be checking on you across the day to make sure that you're going all right.
Part of the education that we'll be doing is talking about your side effects and how to manage them. We need to know any medications that you may be taking or thinking of taking, like natural therapies, and you will need to consult with your doctor about any of those. We'll also let you know if you develop a temperature, what you need to do.
When I first went in, I just felt so welcomed, and also for me personally, any question I asked the nurses or the staff, they had the answer straight away. None of them had to go and refer to anything, and that made me feel very, very confident.
The doctors like to be there for your first day because they like to provide support for you. However, that may not always be possible, but we work very closely with our doctors and we communicate any concerns we have with them, and they're very easy to get hold of.
So when you go in your first day at Icon, they show you around and what to expect, and they take you into the lunchroom, and in there is all the little cheese and crackers sets, and everybody that came in with me, my support team, all had cheese and crackers. It was never called chemo, it was always called cheese and crackers.
Once your nursing assessment has been done and your bloods are fine and everything's okay to go, that's when we start working on getting your chemotherapy done. So we'll access your vein either through a drip or if you've got a special access device, and we'll connect you up and start your chemo.
Yeah, there is no hurting going in. Most people have the drips in their forearm, and that surprised me. I thought they would be accessing the same veins that they use for blood tests. And of course, if you're having treatment more often, it can be very hard to keep accessing veins. So you actually have a portacath in that part, and it's very, very easy for them.
When you are having the actual treatment, you can walk around freely, you can go to the bathroom whenever you want, you can make a cup of tea, you've got your treatment already attached. It's an easy process.
I was to have 6 sessions, 3 weeks apart. One thing that I did learn is that treatment for everybody is different.
It depends on what kind of treatment that you're having as to how long it will last. Some people it's only an hour, and for some people you're there for the whole day, 5-6 hours.
I went in for 3 days every 4 weeks, and that lasted for 6 rounds.
Not everybody experiences side effects, but if you do feel anything that's different to what's normal for you, please let us know, either your doctor or the nursing staff, because things have changed a lot over the years and you don't have to suffer if you don't need to. Nobody knows you like you do, so please let us know if something's wrong.
The oncologist warned me that fatigue will be your constant companion, and that is true. I mean, I can be tired by 9 o'clock in the morning.
For me, the side effect was nausea and vomiting. They were able to give me tablets to actually help with that. So I knew that whatever was likely to be thrown at me through the chemo, I was able to actually get something to help counter that feeling.
I knew that hair loss was going to be unable to be avoided in my case. The hair started to fall out fairly quickly for me. It was after the first treatment. I didn't expect your head would actually feel quite cold, or that you would walk down the hallway and feel the wind bristling against your scalp.
I would wear like a bobble hat if it was winter. I did have a wig I wore a few times, and I did have some wraps. They all came in handy at certain times, but 90% of the time I just was Debbie.
I realised it was important to have a really positive attitude, look at this as a bit of a journey that I was going to take, but there would be an end to this journey, so I felt I could get through that.
So if you're about to start your treatment, I think the best thing you can do, if you've got questions, make sure you talk to your doctor, make sure you talk to your nurses, because they'll have the answers that you need.
Focusing on yourself to make sure you're 100% looking after yourself. Basically, it is everyday life still around you, but you've got to focus on you.
I think leading up to treatment, it's very helpful to be part of a support group, because you'll find there's a lot of helpful people there and actually want to see you have the best experience.
I think the best thing that I can say to you is just relax, stay positive, and we're going to be with you every step of the way.